Hello guys, this skill is donning PPE, gown and gloves, empty a urinary drainage bag, measure and record urine output, remove PPE and hand washing. First step will be to perform hand hygiene. Cover all surfaces of your hands with hand sanitizer and rub hands together until hands are completely dry. Unfold the gown, face the back opening of the gown and place arms through each sleeve. Secure the neck opening and secure the gown at the waist, making sure that the back flaps cover the clothing as completely as possible. Next, put on your gloves. The cuffs of the gloves overlap the cuffs of the gown.
I'm going your CNA for today, and I'm here to get your urinary draining.
Okay guys, always make sure you explain the procedure to the resident and provide for residents' privacy.
Hey, Miss Lucy, I'm going your CNA for today, and I'm here to get your urinary output. Get my supplies.
Make sure you get your supplies, a barrier or underpad, a alcohol wipe, and your beaker or graduate. Okay, so she has already placed a barrier on the floor under the drainage bag. Now you place the graduate on the previously placed barrier. Open the drain to allow the urine to flow into the graduate until the bag is completely empty. Avoid touching the graduate with the tip of the tubing. Close the drain and wipe the drain with an alcohol wipe after emptying the drainage bag. Place the graduate on a level, flat surface. With the graduate at eye level, measure output. Empty graduate into the designated toilet commode. Rinse equipment. Emptying rinse water into the designated toilet commode. Return equipment to storage. Record the output in milliliters on the previously signed recording form. The candidate recorded measurement is within 25 milliliters of the RN test observer's measurement. At this time, our student is gathering her thoughts to make sure that she's doing everything correctly step by step. Make sure you place the call light or signaling device within easy reach of your resident, making sure that the bed is in lowest position. Always maintain respectful, courteous, interpersonal interactions at all times. Let's remove our PPE. Remove gloves before removing the gown with one gloved hand, grasping the other glove at the palm to remove. Slip fingers from the ungloved hand underneath the cuff of the remaining glove at the wrist and remove the glove, turning it inside out as removed. Dispose of gloves in the trash container without contaminating self. Unfasten the gown at the waist. Unfasten the gown at the neck. Remove the gown without touching the outside of the gown, and while removing the gown, hold the gown away from the body without touching the floor. Dispose of the gown in a designated container without contaminating self, and turn on your water. Now you have wet your hands and wrists thoroughly. Apply soap to hands and rub hands together using friction with soap. Scrub wash hands together with soap for at least 20 seconds. Scrub wash with interlaced fingers pointing downward with soap. Wash all surfaces of your hands with soap and wash wrists with soap. Clean fingernails by rubbing fingertips against the palm of the opposite hand and rinse fingers, hands, and wrists thoroughly under running water with fingers pointed downward. Start at the fingertips, dry fingers, hands, and wrists with a clean paper towel. Discard paper towels in a trash container as used, and turn off the faucet with a clean, dry paper towel. And discard the paper towel in a trash container as used. Do not recontaminate hands at any time during the hand washing procedure, such as touching the sides of the sink during the procedure or crumbling up the paper towel used to turn off the faucet with both hands before discarding.
Skill complete.